So welcome back, everyone. I hope you had a nice Wellbeing break during the lunch. Our next session is not lunch, it's a lounge, of the OECD EU policy brief, Healthier Lives, Stronger Societies. The chair of this session is Knut-Inge Klepp, Professor of Nutrition at the University of Oslo and the scientific coordinator of the JA PreventNCD. But before I give him the stage, we will listen to an address, a virtual address, from Sandra Gallina, the Director General for Health and Food Safety of the European Commission. Is that? Yeah, that's on the way. So, Sandra.
Ladies and gentlemen, I would like first of all to thank the President of Iceland. I'm feeling very honored to have been invited to this event. Apologies because I won't be able to be with you. The agenda is simply exploding, but I attach a lot of importance to this event in Reykjavik. It's important to talk about prevention, about the efforts that we all are doing to cope with non-communicable diseases like cardiovascular diseases, cancer. They are 80% of the disease burden in the EU. They affect more than just health outcomes. For instance, they influence how people live and work, they strain families and communities, they put a very heavy burden on health systems and economies, a burden that is only getting heavier. Remember the demographics in this respect. I would also like to say that if things don't change, experts expect that 30% of increase will be there of non-communicable diseases by 2050. There are new figures coming out today. We will also be spending 50% more on these diseases. I would like to say that there is hope. We need to take action on preventing non-communicable diseases so that we can bring them down by 70%. Prevention is the most cost-effective tool. Every euro we invest in prevention, at the end of the day, gives us back 14 euros in economic benefits. For policymakers, this is a no-brainer. There is clear support in the EU for prevention. Since 2022, we had an EU non-communicable disease initiative called Healthier Together. We have put 280 million euros in it. We are supporting also a joint action called PreventNCD with 76 million euros. Now, all countries are fighting non-communicable diseases through the attack on risk factors. This is very important. So I'm delighted today to be here in this event, even though virtually, and I would certainly like to congratulate you all. You're doing something very precious. On cancer, we have the Beating Cancer Plan. It's a success. We have certain elements of prevention that are very strong because we know that 40% of the cancers can be prevented. One of our main objectives has always been that of making people understand the risk factors. We have drawn on the success of the cancer plan to design now another plan called the Safe Hearts Plan. We adopted it in December, as you may know. It's a brand new policy. It tries to coordinate at European level the prevention and the management of cardiovascular diseases, and risk factors again play a big role. We will build also on the PreventNCD joint action to also include better cardiovascular prevention. Well-being is not only physical, as we know. In 2023, the Commission adopted a landmark new approach for mental health with 20 flagship initiatives. It supports, I would say, the health systems in supporting mental health. And this is very important because the mental health, especially of young people, has taken a big blow after COVID. We have many strands that are contributing to the well-being, so this is why this forum is so precious. I would like again to congratulate you all on this event, on the philosophy behind this event. Prevention, prevention, prevention. That is how we redefine success. By approaching it in a collaborative European way, we are helping build a healthier future for us all. Thank you, and all my best wishes to Iceland for this great initiative. Europe is here for you as well. Thank you.
Dear all, welcome to this session on healthier lives, stronger societies. And a big thank you to Director General Sandra Gallina. I think she put it very well. Prevention, prevention, prevention. That is the key to success. And we are going to hear more about that in this session. We have a very strong panel and presenter with us this afternoon. We are happy to have OECD launch their very important report on the health and economic benefits of tackling non-communicable diseases. And it is Michele Cecchini, who is head of health at public health at OECD, who will be presenting it. And then we have Ásta Valdimarsdóttir, who is the permanent secretary and at the Ministry of Health in Iceland. And we also have Marianne Takki, who is head of Disease Prevention and Health Promotion Unit at DG Santé of the European Commission. So please welcome them to the stage. So very briefly about PreventNCD. I think most of you are quite familiar with the project. As you heard from Director Gallina, it's a large project, and as many as 25 countries across Europe is participating. And the main objective is really then to try to contribute to reduce the burden of disease linked to non-communicable diseases by working on the main risk factors. And we have some overarching objectives, and one is then to really support the member states in their work on prevention, and to make sure that the field become less fragmented and more coherent, both across policy domains, but also across countries. We are really trying to contribute to see what would it take to contribute to reduce the social inequality that was addressed so eloquently earlier this morning from this stage. And we are also engaging with various key actors in the field. And in that relation, this meeting here is so important, and we're also so happy then to have both OECD, the European Commission, and member states on stage here. The final main objective we have is to really contribute to increase the quality of data and monitoring. And in that respect, we're very happy that we will have OECD launch their really important new report on the health and economic benefits of tackling NCD. So I think I'll just give the word to you, Michele, to take us through your landmark report. Thank you.
Thank you very much, Knut-Inge. It's a real pleasure to be here, and I would like start by thanking the organization for this fantastic opportunity to share for the first time some of the results of this new work with you today. And I should also acknowledge that the work is co-funded by the European Commission and the European Union, and that made possible the work in this field. I have three basic messages for you today. The first one is that non-communicable diseases affect far more than health. And there is a clear case for action due to their impact on health, but also the well-being and the broader environment we live with. Around half of the premature deaths that could be avoided, are caused by 4 non-communicable diseases: cancer, cardiovascular diseases, diabetes, and chronic respiratory diseases. The onset of the diseases has implication on the quality of life of the person that develop, but also the person around, the years to this person that go much more than the development of the disease as well. Persons that develop a chronic disease have 25% more probability to developing also a mental health problem related to these chronic diseases, creating hundreds of thousands of additional cases of depression and anxiety across European Union member states. This has implication on the workforce, the productivity, the resilience of our economy, but also the competitiveness. We calculated that due to these diseases, it's like losing the equivalent of more than 5 million persons in the workforce every year. And it has also implication on the pockets of these persons, because persons developing a chronic disease have a loss of income in the order of magnitude of 2,600 euros per year, which is far the equivalent of 374,000 crown per year. And all this affects our economy. We are losing the equivalent of around 4% of GDP across EU-EEA due to these diseases. And we're also spending a lot of money in healthcare system. Around 40% of what we spend for the health of our population could be avoided if we were more successful in tackling these diseases. So what can we do? We compared prevention and cure. Of course, it's not a fight between one or the other. We should continue investing in the two, but results are clear. Prevention, prevention, prevention. And I'm the third person in a row that says that provides a better return on investment compared to cure. Investing, for example, on tackling obesity and tobacco smoking, that are the two top priorities across EU, EEA countries, would avoid in this region more than 80,000 deaths compared to 64,000 deaths avoidable if we were to scale up treatment for cardiovascular diseases and cancer. We would have, investing on prevention, a reduction in healthcare expenditure. We would have instead an increase in healthcare expenditure with better care. Normally, we keep people alive, which is a very good thing, but this person will continue having diseases rather than avoiding the onset of the diseases, and this has a cost. And down the line, we would have a better impact on our economy and our workforce productivity investing on prevention. We also looked at what are the priorities for these countries. For the majority of countries in the region, obesity is #1 priority, with smoking being the second one and unhealthy diet being the third. And tackling these priorities would also have broader impact. Let me take the case of Iceland, for example. Better diet, which is the second ranked priority for the country, would also have a positive impact on the environment. Sticking closely to guidelines on consumption of fruit and vegetable and reduction in unhealthy product, would take out the equivalent of around 7% of the cars that currently are registered in Iceland due to the reduction in CO2 production by eating more fruit and vegetable. So what should we do now on prevention? Again, 3 clear messages here. The first one, we need to empower the individual. We need to increase awareness. But it's not enough knowing about the problem. We need to give this person the tool, the mental tool, to take action. But we need to couple this with changing environment. Even the most committed person, if everything around this person plays against his will not necessarily stick to healthier behaviors. Number 3, we need to act on our health systems. We need to reinforce primary care, for example, to ensure that it sustains the behavioral change, but we also need to invest on screening and treatment for secondary and tertiary prevention. My last slide is, I saw quite a few of you taking photos. If you take the photo of the QR code, you can download the report as well as all the results for your country. Thank you very much for your attention.
Thank you very much, Michele, and I encourage you all to take the QR code and download the report. We'll come back to Michele, but now I'd like to turn to Marianne. And in December, the European Commission launched the very ambitious cardiovascular health plan, the Safe Hearts Plan. And we'd like to hear from you, how does the plan then contribute to both make healthy environments and strengthen the citizens' ability to be healthy and enjoy well-being?
Thank you, Knut. I'm very happy to be here today. I don't have any cool presentation like Michele always has. And I have papers, but I should know this by heart because my unit developed the Safe Hearts Plan. Now, why we have the Safe Hearts Plan and how it helps citizens and member states. Cardiovascular diseases are #1 killer in the EU. So Michele explained nicely the huge burden we have from NCDs, but cardiovascular diseases, they cost around 1.7 million lives every year. And I think there's also a little bit of a misunderstanding that the risk is only for the men or the different genders. It's the same kind of risk for women. And there are inequalities between member states in as to how people can access and have good care or prevention. And this is one of the reasons why we wanted to create a new framework, a strategic framework. It's called Safe Hearts. So I'm a head of unit of Safe Hearts. It's very nice to say always. And that framework really sets up 3 pillars. The first one being prevention, prevention, prevention. I'm the 4th person now. And prevention pillar is the basis for everything. The second pillar is about early detection and screening. We need to find those people who have a risk, they might not know that they have the risk, to be able to help them. On cancer, the screening has been over the years developed in the EU, but we now want to do it also for cardiovascular diseases. And then the third area is on treatments. And on treatments in a way that we will have integrated patient pathways. So once a person is diagnosed, they also get the help through a smooth and seamless pathway in the healthcare system. We are now creating, together with experts, a council recommendation on early detection and screening. So that's the first thing as a deliverable you will see in 2026 already. The second will be a council recommendation proposal next year on treatment. And again, on prevention, what we are really trying to do is to support member states to create their own plans on cardiovascular disease, or if they have NCD plans in general, prevention plans, to make sure that the cardiovascular element is strongly in there. And that's why the PreventNCD joint action is so important. And you heard from our Director General that we really want to see also the concrete results to be able to show to the member states that these are the tools you can use to be able to address the risk of cardiovascular diseases. We have also sort of horizontal or cross-cutting themes, which were discussed earlier this morning also, AI, digital tools, all those new elements that we can use in all the 3 pillars or 3 areas that I mentioned earlier. And then finally, research. Already billions of euros have been spent on cardiovascular diseases and risk factors. What we now want to do is to look where the gaps are on research and to make sure that through not only helping countries and citizens to have the best tools available for cardiovascular diseases, we also want to make sure that the companies and innovation and startups will have better opportunities through innovation and research. Mm-hmm. So I hope that with all that we are providing the tools and the possibilities for the member states.
Great, thank you. Mm. So the numbers at the European level are staggering, and there's also clear priorities in terms of policies and action forward. But let's hear then from a country level. And Ásta, Iceland, of course, is well recognized for the work you've been doing in primary prevention. But having seen now the results from the OECD report for Iceland specifically, what do you think are the challenges and the way forward for your country?
Thank you very much, Knut. And good afternoon to all of you. It's really, of course, a pleasure to participate and also a pleasure to see so many visitors in Reykjavik. I would like to start by congratulating the OECD for this publication. It's highly valuable, of course, and clearly demonstrates the scale and of course the urgency on addressing non-communicable diseases. I believe what stands out, in fact, is that the NCDs are not only a health issue. It's a major challenge for well-being, of course, and economic resilience. And of course, as you said before, prevention. Definitely this, we see that working on prevention brings benefits financially and socially. As you said, Knut, while we have made strong progress, we recognize the need to go further. Something clearly acknowledged by our minister, Alma Möller, and the Icelandic government. We realize that if no action is taken now, the burden will only increase. And of course, referring to the documents already here from OECD, we see that if current risk factors and trends remain unchanged, projections show that by 2050, there will be a 42% increase in NCD cases in Iceland, and that is a 93% increase in people living with multiple conditions, and a 69% rise in per capita health spending on NCDs. And of course, as you said, I mean, NCDs also have wide-ranging social and economic consequences. And we know now that they account for 47% of premature deaths in Iceland. So, to answer your question, to address this, I would like to highlight two very important initiatives that we are undertaking now in Iceland. The first one, and this is not really surprising, perhaps, is a stronger focus on obesity prevention. And we, of course, recognize that this is the leading risk factor of NCDs, and targeting healthier food, environment, physical activity, and early intervention is crucial. And this is now a parliamentary resolution that is pending for discussion in our parliament. The second initiative I would like to highlight is advancing personalized medicine. I know this is a bit probably new in this discussion. This is something that we would like to focus on. We would like to use genetic and health data to tailor the right intervention for the right person at the right time. As well, of course, as identifying disease risk and support earlier and more targeted prevention. And if I have time, I would like to point out that we have actually done this in the past. It's a famous project famous at least for us and many other in science, the BRCA gene project, as we call it, for breast cancer, or revealing inherited risk for cancer. And this will also be a parliamentary resolution, and this will be sent to the parliament now in the next couple of weeks. And I think it's important that we have this as parliamentary resolutions. This is important regarding the whole of government approach, and we have done this in the past. For example, we have a health policy since 2019 that was accepted by the parliament in 2019 anonymously, and this is a policy that we're working on to 2030. But of course, we continue addressing other key risk factors as tobacco, alcohol, and others, but we would like to focus on these two initiatives as a new initiatives, actually. Thank you.
Thank you, and thank you very much for presenting these two very clear priorities that you have, and also to pointing out the value of having them discussed in the Parliament to secure the all-of-government approach that you mentioned. Michele, in your remarks, you highlighted the key policy areas for action. But there are, as we know, many interventions, many different policy approaches to take. Now we heard some clear priorities from Iceland, but how would you recommend that countries go about trying to identify the most important policies and interventions to implement?
Thanks, Knut-Inge. Yes, we have heard that Iceland has clear priorities, and that's very good news. There are other countries that perhaps they don't have yet such clear priorities. So clearly, the first priority in this case is to understand what are the options. What are the practices, the practical policies that can be implemented and that can help the country achieve the targets that they have set. And to this respect, I think the work that, for example, the Joint Action PreventNCD is doing is really fundamental for countries to have a clear idea of the set of options that they can implement. At the OECD, we think that in prioritizing the sort of interventions that countries can do, there is what we call the best practices for public health, which is a framework we have developed together, we have co-developed with member countries, and touches upon different dimensions. So we think that for a policy to be considered and implemented by a country, it needs to respect 6 different good dimensions. The first one is it must improve population health to a significant extent. We want policies that really improves the life of the persons. The second, it must have a good return on investment. Countries must spend wisely their money and get value for what they are buying. Number 3, it should address inequalities. There is clearly a trade-off between return on investment and inequalities. We don't want to leave anyone behind. In some cases, we need to compromise between return on investment and inequalities. Number 4, the policy should be affordable. This is something that we don't want just to try as a pilot, perhaps a subnational level. It's something that we want to have the capacity to continue paying for the future if it does the things that we have said until so far. Number 5, it should be feasible, politically feasible, including. There are certain policies that, of course, we need in some cases to compromise a little bit, or we need to move to the target we want step by step. And I'll give you a practical example. We all agree that we want to achieve our tobacco-free generation, if I recollect well, by 2040, Marianne,
yes,
right?
Correct.
It's not feasible to say from the 1st of May we cannot sell any longer tobacco across European Union states. We'll make it to 2040. We need to do it step by step. Last point, the practice should be transferable and scalable, meaning that if there is something that works well in one of member states, we need to be able to transfer, of course adapting it to the local context, of course making the modification, but to the other context. Similarly, if there is something that is applied as a pilot in a certain region of the country, we need to be able to scale it up so that everyone in the country can benefit from this effective intervention.
Great, thank you. Very practical 6 steps. I hope you all took notes. I wish I had done. Marianne, you have not only read the report, you and your team have also contributed and collaborated with OECD in doing this report. From what you see, how does the data that comes out of that help reinforce and give direction to the work that you're doing with the Safeguards Plan? And also, I think Ásta gave you another key word in terms of personalized prevention that you might want to touch upon as well.
So thank you for that very complex question. First of all, I want to say that Michele and I were on friendly terms because we work very closely together. So with the OECD, WHO, UNICEF, we have projects where we work on prevention very heavily. And this work on best practices is something we generated years ago because we have tools, the EU Best Practice Portal, and we wanted to see how we can transfer best practices. These are like population-level interventions like screening for cardiovascular diseases, for example. How can we scale them up and make them more useful across Europe? Now, in terms of prevention, where we are heading towards in the future, PreventNCD is the largest ever collaborative work between countries on prevention. It's the flagship initiative we have on prevention. That's why I invite you all to look at the extensive work that is being carried out under Knut-Inge's leadership and the team. I really congratulate for all the work you've done. Now, in terms of the future, and this is where the personalized stuff comes into, we know what works in prevention. We know lifestyle. We know about nutrition, physical activity, tobacco, etc. Yet we have the challenge. So how can we shift this or turn it around so that in the future we don't have in 2040 some new people here discussing the NCD burden is now 300% higher. I think it's about concrete tools that every single citizen understands. And this is what we want to do with the Safe Hearts Plan. It's a concrete example. We want to have this sort of flow of prevention, early detection, and treatment, and then again a loop back to the prevention so that every citizen or patient has the same possibilities, no matter where they live in the EU, to be able to access the information about their own, the possibilities or opportunities for prevention. Personalized prevention is a new thing. Personalized medicine is something that's really, traditionally we've been thinking it's in the research area, but it's more and more coming into public health. Of course, the concerns from the member states is that it's expensive, but that's where the new tools come into picture, AI and different kinds of digital tools where we can make sure that personally I would be able to take care of my own health as I want, and the same goes for every other EU citizen, and of course Iceland and Norway.
Thanks. Time is running fast, but we do have time for questions from you all. So are there some takers? Any questions or comments to the panel?
Knut, can I comment?
Yes, please.
On what Marianne?
Go ahead, and then for you to think of what you want to ask after.
I will be brief. I just would like to point out that we are not members of the framework of the Safe Hearts, not yet. But I mean, I talked to Marianne here for 5 minutes, and she absolutely convinced me. Definitely. So we will have another presentation next week, and this is something. I mean, the framework makes sense, definitely, and this is something that we would like to absolutely be part of.
Thank you.
Thank you, and congratulations, Marianne, on your recruitment strategy.
Like a superstar. Like a superstar for a moment.
Any questions or comments? Yes, there's one in the middle of the room, and then one over there. Do we have someone taking the microphones? Oh, yeah. There are microphones here. We'll take 2 quick questions. There was a hand down there as well, and it's good if you come a bit closer across to here.
I think it's a very good opportunity to greet all of you. I'm from Mongolia. We are actually representing here Mongolia, which is a country from Central Asia. And we are here to learn from you guys and Europe how to tackle well-being issues in our countries, So my question, actually, we are a team of Optimal and Max company where we try to develop science and technological based projects to support individual well-being, including mental health, workplace well-being, and financial well-being. So, sorry. Okay. So within our company, we developed this mobile application in order to provide people the opportunity to build a positive lifestyle, positive habits, in order to create a positive lifestyle. Our aim is to prevent NCDs and mental health issues in the future, especially for young people. And how is your opinion on using technology, like technology-based preventive approaches in order to make long-term impact?
Thank you very much.
Do you think our approach is, promising or not? Like, I wanted to know your opinion on the tech-based preventive approach. Thank you.
Great, thank you. We'll comment on that, but I think we'll take one more question, and then the panel can address.
Hi, thank you so much for all those interventions, very interesting. So my name is Livio, I'm a medical doctor, health specialist at the World Bank and part of the youth advisory group to the Joint Action PreventNCD. And I wanted to thank you for all the emphasis that you put on youth mental health in the conversation to having healthier societies. And wondering how the court that the OECD has granted itself youth-wise has been involved in coming up with those conclusions, and also for the implementation, how they will be involved, and whether there was a possibility to have them on the stage with you today to have this conversation, as it is very important, as you stated. Thank you so much.
Great, thank you. And if you could pass on the microphone, we'll have a third question before we give the word back to the panel.
Did you have something with just because we had? Okay. Tony Houlihan is my name. I'm director of the WHO Collaborating Centre for One Health in UCD in Dublin, and I'm former chief medical officer. I was chief medical officer in Ireland for 15 years and had policy responsibility for, among other things, non-communicable disease and cardiovascular disease and so on. So thank you for a very interesting presentation. I want to maybe just focus on your thoughts on two things. One is around implementation. Much of the knowledge that we're talking about to transform global experiences and regional experiences with non-communicable disease is knowledge that we already have, but we don't effectively implement. To illustrate that, there's a thing that some people will be familiar with, which is called the rule of halves. So if we take the population of people with high blood pressure or high cholesterol or any common risk factor like that, we know or have detected about half of them. Of the half that we've detected, we have half of them on treatment, and of the half that are on treatment, about half of those are controlled, which is 1/8 of the total population. So that's knowledge that we already have that we're not effectively implementing. So how do we get over that challenge of implementation, which is endemic within the health system? And it also relates to the challenge of One Health, which is the interrelationship between human health, animal health, and environmental health. Because actually, many of these challenges of chronic disease are exactly the same challenges as exist in terms of things like biodiversity loss, or the climate emergency, or energy and water distribution, simply just in terms of how they're manifested in terms of human health. We're fighting the same battles in different sectors, but we're not finding effective ways of joining those things up. And the way in which we can do that is to improve literacy and agency and engagement at the level of populations in a way that really understands that when we talk about making healthy choices, the easier choices, the way in which our economies and our societies are designed and function do not make that easy for people.
Great, thank you. 3 questions: digital health, youth involvement, and also implementation and One Health. I'll let all 3 of you have a final word because we are running out of time. Anyone who want to go first? Ásta?
Yes, thank you. Maybe I should try to answer this very important question or remark from Ireland. I think, of course, it's very important to realize that it's difficult to implement many of the actions we're discussing. And there is no one solution to that. I mean, of course, we have to try to convince the society, the individuals, and build trust, actually, in the government and municipalities that we are doing this on their behalf. But then, of course, that there always has to be a mixture of incentives and some strict regulations. I mean, we can talk about tobacco, as you mentioned before, alcohol consumption, etc., etc. There has to be a mix. And it's also very important that we start very early on. And if I may, I was very pleased to hear yesterday that, for example, Reykjavik municipality, or the city of Reykjavik, decided now not to serve processed food in schools in Reykjavik. Fantastic initiative. As an example.
And brief comments from Marianne.
Well, maybe I could say about the youth involvement. Thank you for the comment. It's super important. Now, in terms of youth involvement, I think we are better than we were years ago. So for the Safe Hearts plan, we had targeted consultation with the youth representatives, those with heart problems, and I think we did it together with the Joint Action PreventNCD, the youth group that you are representing as well. And next week, on Friday, we are co-organizing with the European Parliament an event where we will discuss Safe Hearts plan, and I think your group is also involved in that. And then we have a thematic network on a sort of a commission platform where the young people and the different organizations can come together and discuss. I think it's now more organized on prevention than ever before because of the joint action. But we need to still make it better in terms of integrating the opinions and the views when we start to implement. We often consult a priori, so before we have the proposal, but we need to bring on the right stakeholders into the implementation: hospitals, doctors, the health professionals, nurses, pharmacists, but also citizen and different generation advocates. So I think that's very important. And then the final thing on implementation, from the colleague from Ireland, I see that you've had your share of working on these issues because, yeah, implementation is the key, of course. We shouldn't do new proposals if we don't have already in mind how they can be implemented. But this is not one-person show. No. It's really member states, commission, the different international organizations, and the stakeholders who all have to come together. And it's not about specific different diseases or silos. We have now an opportunity on health to do something, and I think we should do it together, forgetting who is interested in what specific issue. Because if we don't now push things forward together, nobody will win.
Absolutely.
Thanks.
Very quickly, I think I'll take the first question. So we cover the three of them. New tools, digital tools to support behavioral change. Yes, it's part of the set of potential tools that can be used. Few things to keep in mind, perhaps. The first one, we have looked a little bit at this, and there is tools and tools. There are some that are helpful, others that perhaps are a little bit helpful. They need to respect the regulations, including, for example, on data privacy and so on in the European Union states. Number three, we saw that there is a little bit of risk of increasing health inequalities. Persons with higher level of education tend to respond better to this type of tools compared to persons with lower level of education. Doesn't mean that they shouldn't be used, those that work well, those that respect all the rules. It means that it's not the magic wand that will solve all the problems.
Important point. Thank you very much to all of you.
Thank you so much. Yeah, there's no quick solutions.